Here is your station.
Yes, I'm ready.
Okay, so if you have read and understood, considering it communication skills station, please begin.
Hello,
Hello.
I'm Dr. Ali Bade, SHO working for Mr. Man in Mumbai Hospital. I'm calling to speak to on-call consultant. Can I check that I'm calling to the on-call consultant?
Yes.
Okay, I'm calling you to ask you advice about patient developed post-operative oliguria, and he is now hemodynamically unstable.
Okay.
That's right. I have a 69-year-old female underwent right hemicolectomy 24 hours ago. And intraoperatively, there is minimal blood loss, and the patient received 2 units of blood. And post-operative course was going well. But today, the patient, I noticed the urine output was only 10 to 20 ml in the last 8 hours. And on examination, the patient is tachycardic and hypotensive, and the temperature is 37.5 degrees centigrade. And on my examination, the abdomen is lax, not tender. And on the investigation, the hemoglobin is dropped by 2 from 12 to 10. And the urea and creatinine is rising. And the ECG is normal, just X-ray was clear. And I review the fluid chart. The patient received only 1,100 ml of normal saline in the last 24 hours. Based on this, this patient is developed post-operative oliguria due to dehydration. I'm calling you to ask you advice about this patient.
What do you think the cause is?
This patient developed post-operative oliguria due to dehydration, and he's received only a minimal amount of fluid in the last 24 hours, 1,100 ml of normal saline.
1100.
Okay. Okay. You think the patient is dehydrated now?
Yes, right.
Why the creatinine is high?
Yes, this patient developed pre-renal failure due to hypovolemia.
Okay. You think there is decrease in the maintenance fluid? Or
Yes,
do you think there is more losses in the operation?
in the operation there is a minimal loss, and patient managed by receiving 2 units of blood.
Okay. So what are you going to do with this situation?
All right, in this case, I will start fluid challenge by giving patient 250 to 500 ml of normal saline over 15 minutes, and I will assess the patients. If there is no response, I will repeat it till 4 times.
There is more as well. If no response, you'll transfer the patient to HDU and
Yes,
infrared.
after the 4 times, if there is no response, I will transfer patient for the HDU, for close monitorings, for CV lines, and for considering also for any drops in the HDU.
Yes, and arranging blood.
And also is the next day I will do the hemoglobin and also for arranging blood transfusion in HDU.
Good.
Okay. How you are going to assess or follow the fluid channel?
Yes, I will follow this patient by doing regular blood pressures, heart rate, respiratory rate, urine output, central venous pressures, and capillary refill time.
Good.
Do you think the patient is bleeding?
The bleeding is one of the differential diagnoses. But for now, I will monitor his vital signs continuously. I will do serial abdominal examinations. And if any sign of bleeding, I will let you know.
How do you know the patient is bleeding?
If there is deteriorations of his vital signs, like there is continuous hypotension and not responding to the fluid, challenging, and also the abdomen will there will be tenderness in the abdomen, there will be fullness in the abdomen. Also on the serial abdominal examinations and the abdominal ultrasound will show there's a fluid collection.
Okay. Do you think is the anastomotic leak?
Also, anastomotic leak will be one of the differential diagnoses, but for now the patient is not toxic and the abdomen is lax. I will monitoring his abdominal examination. I will monitoring his abdominal examination regularly, and if patient develop sign of peritonitis, his abdomen becoming tenders and he becoming toxic, I will let you know.
Okay. Do you need me to come back?
For now, I will start fluid challenge. If no response after the 4 time, I will update you.
Okay. Does he require HDU transfer?
For now, after I will start the 4 fluid channels after the 4 time. If there is no response, this patient need HDU refer for more monitorings and for considering for blood transfusions and central venous line insertion.
Does he require operation now?
The operation for now, if there is no sign of bleeding and there is no anastomotic leak, for sure he does not need any operation now. Just we have to start fluing and to see what will happen.
If HDU is full, who are you going to speak to?
Yes, I will speak to the bed manager in the HDU. I will tell him about the urgency of my case in the situation he doesn't respond to the fluid channel after the 4 times. If there is no way, I will let him to discharge or step down the more stable patients to the general ward.
Okay. Do you think the patient is shocked?
Patient now, yes, he is for shock.
And what is the causes of this patient shock?
This one, dehydration, hypovolemic shock, and also maybe septic shock.
How you are differentiated between septic shock and hypovolemic shock and examination?
Yes, and in hypovolemic shock, there will be and tachycardia
Okay.
and
How about the skins of lower limbs?
Will be their worms of the skin.
Worms and
Cold.
septic.
Warm septic, yes.
Okay, good. What do you do? Fluid challenge him and those.
The fluid challenge, I will start by 250 to 500 in 15 minutes, or doing calculating the bolus dose by 20 ml per kilogram.
Okay, good. Is the patient need hemodialysis? And what are the indication of hemodialysis?
For now, no need for hemodialysis, but the indication of hemodialysis if there is a severe acidosis or persistent hyperkalemia.
Okay, summarize your case.
Yes, I'm calling you regarding this patient developed post-operative oliguria, and the plan of management, I will start fluid challenge by giving patients 250 ml to 500 ml of normal saline over 15 minutes. I will repeat this 4 times. If there is no response, I will transfer this patient to HDU for insertion of the central venous lines and for close monitoring for his blood pressures and other vital signs, and also for blood transfusions and also for any drops. And I will request the new blood test to monitor to see hemoglobins.
Okay.
That's
Good.
right.
Yes, you can send the patient.
You can send the patient now.
Yes, thank you very much. I will let you update it.
Thank you.
Okay.